So good morning, everyone. I'm Russell Johnston, Senior Associate Commissioner here at the Department of Elementary and Secondary Education. We're really glad today to talk to you about our pooled testing initiative for K-12 schools in Massachusetts. And just to kick things off, I just want to let you know a little bit about who's here with us today. We've got from here at DESE, myself and my colleague, Lauren Wu. Lauren is hosting the meeting right now and can certainly assist with any technical issues that might come up. But between the two of us, you've got the DESE representatives from the Department of Public Health and the Health and Human Services COVID-19 Command Center, Dr. Katie Brown, Elizabeth Larson, and Jeremiah Hay. We're really pleased that we've had such great support from the Shaw Foundation, particularly Jill Shaw and Ross Wilson, who are here with some of their colleagues today. And then, our really esteemed guest, our really valued guest, we have some district leaders who are actually going to be able to talk to you about their lessons learned from implementing or about to implement pool testing in their schools. And so really pleased to have Dee Dee Galdston from Watertown, Maurice Edward Vincent and David Murphy from Medford, and Steve Zreich from Salem. You'll be hearing more from them towards the end of today's presentation as well. So thank you again for joining us. I'll show you the agenda in just a minute, but if you're joining us just a little bit late, if you wouldn't mind turning off your video, we'll keep the presenters' videos on, just so that we keep the smoothest stream possible when we have this many people participating. So thank you all again for joining us. And really a shout out to everyone who's here today. We have district leaders, school health leaders with us. We have local boards of health. We know that there's great interest in this, and so we will certainly be sharing this recording and posting it online. And Lauren is putting these slides into the chat so that you have them. I will certainly be going over the slides, kind of voicing over the narrative, but I also hope this is information that you can use, that these slides are a resource that you can use if you need to explain pooled testing in your local community as well. So thank you again for your interest, and we hope that we answer many of your questions today. We know you'll have many more. And here's an important thing about today's presentation. We really encourage you to put your questions in the chat. They're coming to Lauren right now. If you just send them to the host, they'll go to Lauren. And what we intend to do is to use the questions if we don't answer them all today, and we will certainly leave time for questions and answers at the end. But if we don't answer them all today, we will follow up with more written information for you in very short order in order to provide you with the information you need in order to decide if this initiative is right for you. So keep the questions coming, and if we don't get to them all today, we certainly will follow up to get you the information that you need. So thank you again for your interest. Thank you for the questions, and thank you for your participation today. So here's what we want to do with your time today. First, we want to start with kind of a rationale. Why are we doing this, and an overview of the what and the who can be involved in this early launch of pooled testing. Then we want to talk about what pooled testing is itself, just a little bit of a primer, a little bit of a background on what pooled testing is, how we are setting up a contract for pooled testing, those required preconditions that we'll need districts to meet in order to be ready to implement pooled testing. And then I think the showstopper will be at the end when we have our three district leaders joining us to talk about their experiences, their key lessons learned, just so that you can see what this means from a district perspective. I think that's always so powerful for those of you thinking about starting this initiative yourself. And then, of course, time at the end for next steps and questions and answers. So let's jump right in. Our rationale and our overview for pooled testing. So we really appreciate the efforts that schools across the state have made to implement the key mitigation strategies of hand washing, physical distancing, wearing masks, especially wearing masks, and staying home if we're sick. We know that those four mitigation strategies are just drilled into us. We know those are the core mitigation strategies. But we also know that testing could be an additional mitigation strategy. We know schools can be open without testing. We know that they have been since really since last school year. When you think about the residential schools here in Massachusetts, that we have been able to maintain learning for children really all throughout this pandemic. And then certainly starting this fall, we've been able to safely return students to in-person learning in many, many schools across the state. But we know that testing could help to perhaps get even more students back. And when we think about the types of testing that we already have in place, like the Rapid Response Mobile Testing Unit, Abbott Bionics Now rapid antigen tests that are available, we think about pooled testing as sort of the next step, the next kind of technology, testing technology that we have available for districts. And we feel like the time is right to do this on a couple of levels. First of all, pooled testing at the level of capacity that we're talking about. We have about 1 million students here in Massachusetts. And when we think about trying to reach as many of those students as possible, that is a huge volume of tests that labs would have to process, and to make sure that we know kind of how many of these swabs, frankly, can go into a tube to be processed, had to be worked out, had to be understood, had to be learned about in order to make sure that it could be done effectively. We really appreciate the way in which the medical and scientific community here in Massachusetts on the private side has really invested in this, invested in figuring out how pool testing could work for our schools. And so the time is right because the technology is available. The time is right because the finances are available. There is a cost associated with this, no doubt. The state wants to assume a portion of the cost, but then districts will ultimately have to pay for this in the long term. But this is a great time for that because there's such a healthy amount of stimulus money coming to the state. So, what's been explained to me is when we think about the stimulus money that we had previously, we're talking about 4 times that amount coming in now from the federal government for our schools. It's available for a lengthy period of time. And so just using kind of back of the envelope, calculations on this, we feel like this is a possibility that we didn't have before. And so we're really excited about the idea that, that those 2 conditions come together. But I would say the third really important condition that really adds to our ability to do this right now is frankly the way in which districts, and not just the 3 who we have presenting to you today, there are other districts in the state as well that are doing pooled testing, and they've shown us the way. So that what we're asking you to do is certainly to be on the cutting edge of this initiative, but not the bleeding edge of it. We really appreciate the way in which our district partners out there have really taken this on already and helped us show us what's possible. We've really paid close attention to them. Really appreciate the way that the Shaw Foundation has really brought us all together to learn from each other, so that what we bring to you today is something that we've seen working right here in Massachusetts. And we're so excited about this idea that you can now take this on, knowing that, again, we have confidence in how it can work, that it is possible within our public schools. And so we just know that, again, this is another tool in our tool belt to create more resiliency in order to safely stay open for our schools, for our students, for our staff, for our faculty. So with that in mind, that's sort of the background on this. That's our rationale. But now let's move into the who can be involved. Who can be involved in this early launch of a pooled testing initiative that the state is initially sponsoring? And this is important because back in December, as we began to kind of bat around how to do this, and keep in mind, all of this is new for all of us. Certainly when we all did our graduate studies in education, no one ever thought that we'd be at a point now where we'd be talking about how to do all these different types of COVID testing in our schools. But we're here, and I'm so pleased that we've arrived at the spot that we're at today, but it's a little bit different than what we were talking about in December. In December, some of you know, but maybe not all of you know, that we were looking at a more limited number of participants. We were saying, maybe we could start kind of an early pilot with maybe 10 school districts in the state to get started with us. I'm very pleased that we've rethought that, and we're calling this an early launch instead of a pilot, because we want any district that can meet the prerequisites, that can be ready to take this on, to join us. So there will not be any kind of cutting out of any districts that are interested, that want to participate. I hope you saw our memo on Friday where we included a survey for you to fill out if you are preliminarily interested. And I would encourage you to take that step. If you have preliminary interest, this is voluntary, and it'll just keep you in the loop, keep you getting messages from us about those next steps, and kind of deciding along the way, is this the right thing? Kind of take that next step with us. If you're here today, it just might be something that you want to learn more about as you continue to figure out if this is the right thing for you. So there is the option right now for any district that's providing in-person learning to participate, but also if you're in a remote model, and this really is our goal, that if we think if this, along with other mitigation factors, other mitigation strategies, can help you bring more students into some form of in-person learning, we want you to participate. So in a sense, this really is available for everyone. I guess if you weren't planning to come back at all, if you're in a remote model and you're not coming back, there really wouldn't be a reason to do pooled testing anyway. So if you are providing in-person learning, or if you plan to move towards in-person learning, we want you to consider participating. And so keep in mind that we are casting a wide net to all of our local education agencies, districts, charter schools, as well as education collaboratives and approved special education schools to join us in this early launch. We're also working to kind of pave the way as best we can for private and parochial schools where we can't apply direct public funding. We want to help them be able to do the contracting that they would need to do to set this up for themselves. And then the final thing that I'll say, and I really want to make sure everyone's hearing this very, very clearly from us, is that when you think about starting this initiative in a school, we definitely want everyone who steps foot in that school to participate. So obviously the teachers, the paraprofessionals, the students, but also very much and equally the custodians, the school security personnel, the clerical staff, and the cafeteria staff, because we want to make sure that this is available to everyone who we just want to know what the prevalence of the virus is, and to make sure that we can take those steps to immediately respond to any kind of presence of the virus in our schools among any staff member, among any student. The one thing I would clarify though is that, and we've been asked this a fair amount, is if you're a district, for example, wanting to participate, does the entire district need to participate? And the answer is actually no. You could have part of a district participate. There might be a good reason for that, and we'd want to know why. But there could be a good reason. It could be about capacity as we get started. Maybe you can only do this in the upper grade levels. And so, maybe your middle school and your high school will begin by participating. But the bottom line message is that if you do bring in, for example, your middle school and your high school, we would want everyone in those buildings to join in this pool testing initiative, not just some of the staff in particular. So I hope that helps to clarify the who. Now let's talk about the what. What is this early launch? So, and then what's beyond it? Where do we go beyond the early launch? So we are planning to start with a 6-week initial period of making pool testing available that the state will provide really all of the services, the test kits, the support from a testing service provider, the technology, the software that you would need to run this at no cost. And then after the end of that 6-week period, we intend that by that point, the stimulus money would be available to you for school districts to use directly. And so our goal would be that at that point, you would, if you stick with us, and we hope that you will, that you would then take over the contractual arrangement for this. But what's important about what we're doing is in concert with our colleagues in Health and Human Services and Public Health, we are making sure that we have a statewide contract for you to purchase from, so that you don't have to go out and do procurement on this, that we kind of iron out a lot of the both financial and legal issues that are involved in contracting, and we're very much involved in that right now to get this ready for you. And so that there will be a statewide contract list that you could use to purchase these services from using your stimulus money. And now, this might be going through your head though, of like, we might not want to participate in the 6-week launch from the state. We might not be ready yet for whatever reason. Maybe you want to join later. Well, if you don't join the 6-week early launch, you can certainly then begin this by purchasing off of our statewide contract. And our hope is that our statewide contract will become available during this 6-week period, hopefully not maybe at the end of it. So as soon as that statewide contract is available, districts that aren't participating in the 6-week early launch could then begin to purchase those services directly off of the statewide contract that we'll make available for you. So I hope that helps with who can participate and what participating will mean. Elizabeth, I just want to pause and see if you have anything that you want to add before we move on to the next section, which is really the overview of pool testing. But anything that, this is my colleague Elizabeth Larson from Health and Human Services, the Director of Strategy. Elizabeth, anything that you would want to add about the who or the what?
No, I think you've captured it, Russell.
Great, thanks, Elizabeth. So let's go on to the overview of pool testing in our schools. What is pool testing? How does it work? I know some of you have done exhaustive research on this and can probably tell me more about it than what I know. Others of you might be kind of new to pool testing, so let me just give you a quick overview of how it works. So the idea is that about 10 to 25 samples of swabs are pooled together, batched together into one PCR test, so into one tube. And then the test that is performed on that tube is actually an anterior nasal swab. So it's the short swab. I know that my son got tested last week from his public school district, and he came home and said, that was so easy, that I barely felt it. That's the type of swab that we're talking about, the very kind of, gentle tip of the nasal type of swab compared to, how PCR testing initially had to be performed at the beginning of PCR testing. But the idea is that each student would experience this, any individual in this school would experience this swabbing once a week. The pool will be batched together and run by the lab, and we're very fortunate that we have such strong lab capacity here in Massachusetts, with the results coming back within 24 to 48 hours. And the samples can be administered by trained staff, by trained school staff. And then, what's really important about this is that because of the advancements that have been made in pool testing and because of the work that we see happening in districts, we know that students in certain age groups can actually do their own swabbing under supervision. And so that's really key. That's really important that, it might, in some cases, it might mean kind of students lining up to get swabs at a centralized location within a building. But in other cases, it might mean, as we all kind of picture this in our head, that swabbing could happen in the classroom, that students could do their own swabbing right within their classroom. So there are different ways of actually completing pool testing. You're going to hear that from our district presenters today. And so I would hope that all of you kind of keep an open-mindedness about, what might seem challenging. We have different ways of overcoming those challenges. And so I hope that you will, just see that different ways of administering pool testing, different ways that students can be involved, all to make this very possible and doable in our schools. So the next part of it is about what happens as part of the protocol when the results come back. So if you imagine 10 swabs going into a tube being processed in a lab, when those 10 come back, if the test is negative, and in most cases it will be, then everyone is presumed negative who's in that pool, and they remain in school. And really nothing happens. In most cases, what we know of how pool testing is working is that no news is good news. So people aren't finding out individually that your test was negative, that you were part of a negative pool. It's only if there's a positive pool that next steps have to be followed. And so obviously if a pool comes back positive, it means at least one individual within that pool, and again, I'm just using 10 for easy numbers. So just imagine it's a group of 10, at least one out of those 10 swabs was from a person who is presumed to be positive for COVID. Keep in mind, it's a PCR test that we're running to find that result. So it's, it's a really good first step to figuring out if that pool has a positive result from within it. And our recommendation, our primary mode of doing follow-up testing is going to be the Abbott BinaxNOW rapid point of care antigen test that we have over 100 districts right now across the state using for symptomatic individuals. So our partners at the Department of Public Health have really been looking into Abbott BinaxNOW for this use. And Dr. Katie Brown is going to speak to this in just a minute. But we think that this is really important for this very reason. If you think about that pool coming back, and again, using 10 as sort of a round, easy number, that's that group of 10, the district is going to have to notify, or the school is going to have to notify to tell, let's just imagine it's students, so to tell the parents that, your child was part of a positive pool, and now they have to somehow get follow-up testing. We think that Abbott BinaxNOW is the right choice for this, not only because of its very appropriate level of sensitivity and specificity, meaning it's a very effective way of identifying the virus, but it's also the way in which the results come back so quickly. So Abbott BinaxNOW gives you results within 15 minutes. So if you imagine that, that parent that gets that message needs to arrange to have their child through the school department have that follow-up test. If it's an Abbott BinaxNOW test, they're getting those results within 15 minutes, as opposed to the results coming back within a day or two. And we just imagine how disruptive that would be to families, to children, to teachers, to say that you'd have to wait a day or two to get your results back versus 15 minutes. That really changes how you can plan for your day, for your week, for your life. if you know that you're getting those results back quickly versus the results taking longer. And there could be a rare event where even though there was a positive pool, and if Binax now shows no positive individual results, then there would be the need to maybe follow up with PCR testing. We're just trying to make sure that we cover all of our bases, but we're very confident that Abbott Labs Binax now rapid antigen test will actually be very effective at helping us sort out who might be that individual or individuals from within a pool who we do need to make sure take those steps to be treated appropriately for COVID-19. So Dr. Brown, I wonder if you're with us this morning and if you're able to just speak to a little bit more information. I know there's some questions out there about, Abbott Binax Now is an antigen test. Are antigen tests as good as PCR? Is this test as good? There's been some studies done. There's an important study that you all are conducting right here in Massachusetts at Lawrence General. And I'm wondering if you can say anything more about Binax Now, and particularly Binax Now for children. And so I think that would be really useful for our participants today.
Yeah, good morning, and thank you, Assistant Commissioner. I appreciate the opportunity to address those questions. So I will try to be pretty brief, and I will also probably tell you something that you already know, but there are a couple of points that I want to make sure that I hit. So just a reminder that there are really two types of tests that we use to diagnose current COVID infection in people. One is a test usually just generically called a PCR test, which looks for the genetic material of the virus. And then there is the antigen tests, which actually look for proteins on the surfaces of the virus. PCR tests have generally been considered to be the gold standard test, but they have problems, right? In that it takes a while for those test results to come back. And so antigen tests have been explored as having some potential significant benefits in terms of the rapid turnaround time, that they can really be these point of care tests. I want to be really clear that any laboratory test that you've ever taken in your life or that you will ever take in your life could produce either a false positive or a false negative. It's just a fact of laboratory tests. The trick is to understanding what we call the performance characteristics of a test. So under what circumstances are they likely to produce either a false positive or false negative? And then you think about the circumstances, the way in which the test is going to be deployed, and utilize it in a way that's going to minimize the opportunity for, a false positive or false negative. So when antigen tests kind of first hit the scene, Abbott Binax Now was not one of the first ones, and there was some concerning data that came out from associated with some of the other antigen tests, showing that maybe they weren't that great. When the Abbott Binax Now came out, it really was a game changer, or a potential game changer at the time, because it was such a relatively easy to do point of care test that there was a lot of excitement about the possibilities, and yet also concern about how good a test it would be. So we in Massachusetts worked very hard to put together a very good validation study that was done, where people were tested both using the Abbott Binax Now and the PCR. And the results of those studies have been online, and you may be aware that what they showed is that the Abbott Binax Now was best at detecting infection in symptomatic individuals within 7 days of their symptom onset. And it also, to be honest, showed a little bit better performance in adults than children. So the question I am sure that you all are asking is, why now are we okay with suggesting that we're going to use this test in asymptomatic kids, the group that maybe it showed the greatest problems with? Well, so one of the tricks to improving, it's not really a trick, but one of the tricks to improving the accuracy of laboratory tests is to is to sort of layer them, is to do more than one. And so what we're doing here is taking a pooled sample, which is already positive. So you are increasing the probability that the people in that sample are positive, and then apply, because you've used PCR test, the gold standard, and then you are using the Abbott BinaxNOW on top of this, on this kind of very small data set where you already know there's an increased probability of a positive, to test those individuals. And we have a lot of confidence that by layering these two tests on top of each other like this, that the Abbott BinaxNOW, that it limits sort of the potential loss of accuracy that the Abbott BinaxNOW has as a standalone test in this population. The other thing I will say about the Abbott BinaxNOW is that in all groups, including asymptomatic children, it was very good, like almost 100%, very good at detecting people who had a large amount of virus present, meaning that they were very likely to transmit. And so those are the reasons that we consider that the Abbott BinaxNOW is a very good choice in this particular setting, to rapidly identify anyone who is positive based on the findings of that positive pool. Russell, did that sort of cover the things you wanted me to cover?
Yeah, absolutely, Katie. I really appreciate that. And maybe if you're able to stick around for questions and answers at the end, we could find out,
Of course.
how people think about that or respond to it as well with questions. So thank you so much. That was extraordinarily useful. I just want to pause really quickly before I go on, actually, because I'm noticing that we are capped out at 1,000 participants, and I'm getting messages personally from district personnel who are saying really want to participate. We are prioritizing district personnel, obviously, for this because they need to make the decision about participating. So if there are multiple people here from the same community, there's a local Board of Health member and a school department member, if I could ask that people help to drop off to let others in, that would be really useful to try to consolidate the information. We will post this recording so you can come back to it and get the information that you need. But we do want to make sure, and I can see the numbers dropping a little bit. Hopefully they'll go back up a little bit to let some others in, and I appreciate you getting the message right now. So thank you very, very much. As we just move on, let's talk about how this statewide contract will work. So the way that the contract will work is that we will have a few different test service providers available that we will match up with districts. We don't want to put all our eggs in one basket, particularly because we want this to be available for a large volume of students and staff members. And we appreciate that we have such amazing partners here in Massachusetts who can do this work and who can fulfill this role of being the testing service provider. But we're talking about a fair amount of lab capacity that we'd be taking up. And so we think that it's important that we work with at least a couple of labs to be able to support the volume that we might have coming in. So when we talk about testing service provider, again, it's important to know that we are looking at more than one right now. The work that they would do is the onboarding and training that's necessary to get staff ready for this, to know what it takes to take on this initiative. The lab processing is obviously huge. A secure tech system is very important. So, obviously that tube has to be tracked, and then the results have to come back to the school in a very streamlined way. So we're wanting to make sure that any of the vendors that we work with have the capability, and we're really vetting that to know that that their technology will work for you. We're so pleased by what we're seeing. We're so excited about what we're seeing for a very streamlined, very kind of intuitive system that will provide district leaders, school staff with the information that they need. And then of course, customer support. And I think it's really important that we've kind of built these testing systems one on top of another. So when I think about the mobile testing unit, the BinaxNOW, and now this, we've learned a lot about what schools need in order to take on testing initiatives, in particular this customer support portion of any contract that we develop. We just know is so important for you to be able to pull this off well. Schools and districts, there'll be work or so resources that you would have to apply to this. And so the ability to coordinate supports, coordinate the administration of the program, overseeing the operations, and then conducting those follow-up tests on positive pools. It would be some of the key services that we would need districts to take on. But I'll say a little bit more about how we are, in a sense, tiering our contract so that districts that need more support with those types of services could actually contract for them. If you can't, if you don't have the staffing to pull them off on your own, we understand that, and we want to make sure that we have a solution for you, because overall, our goal for you is that this is more of a yes and rather than a no, than a no but. That we can figure out ways to get to yes on this by having various solutions available for you. Elizabeth, before I go on, just anything else you want to say about the contract and the services that we're developing?
No, I'd say we really view this as a partnership between the state, the schools and districts, and these pool testing service providers. And we're excited that everyone is putting something on the table in terms of getting this up and running. We know that there's a whole number of models that can work in schools and school districts, and it's not one size fits all. So I think you can expect further guidance from both us as the state, from DESI and DPH and the command center, as well as the pool testing service providers as to what really are the options for specimen collection. How can I make that more efficient, or implement that in a way that will be as quick as possible? How can I set up my school for success for follow-up tests on positive pools? What is the appropriate protocol for consent and authorization from families? And I think we're here to help in this partnership, and I think you can expect shortly further guidance on a number of those things to help you think through what really is the best model on the ground for your school.
Great, thanks, Elizabeth. So thinking about those, the services that would be included in the contract, again, we will have this contract that's available for you to purchase off of, and we've been asked a lot about cost, and so what our assumed cost right now, our approximate cost, is $5 per swab minimum. And again, if you're a district that would need to add on more services, particularly for any of the operation or administration of the testing in your schools, then the price would likely go up. But a good kind of rule of thumb at this point is about $5 per swab. So I hope that helps those of you who are involved in the finances of this to kind of know what to expect in the way of the cost that we're driving towards. And then, the kind of just building on what we talked about before, that the provider will work on operational and logistical types of issues like delivering the test to the schools, the hardware such as the tubes, the labels, and so on, as well as that communication and collaboration with the testing lab, because there could be multiple vendors involved. That vendor that is doing the kind of operations and logistics might not be the same vendor who is actually running the labs. And so that there would need to be sort of a coordination across those vendors that we're asking one lead contractor to be responsible for. Obviously, kind of just adding to what we talked about before, the technology software, the training, and the customer support. So again, just reiterating what we talked about on the last slide, but hopefully giving you that strong sense of what it is that we are working on contracting for, so that kind of what's included, and frankly, then also what would be the responsibility of the district. Like Elizabeth said, this is a partnership that takes effort from all of us to get this off the ground. So I mentioned additional services because, again, we know that particularly as we've talked with the leaders, the district leaders that you're going to hear from, as well as just other people who are interested across the state to understand what their staffing availability is, what the logistic considerations are from each of their buildings. We think that in most cases we want to see districts relying on the personnel that they have available, or ways in which they can contract for some of these services themselves. So in most cases, having staff who can manage the testing logistics, administer the specimen collection, administer the follow-up testing, and then transporting the test to the lab. So thinking about like once a day, those tests that would be available at an elementary school need to be couriered to a lab somewhere in the state. And so doing that courier service would be something that in general we would be asking districts to figure out how to do for themselves. But if that's not possible, we want to make those services available for purchase. So if anything that I just mentioned essentially isn't possible to do on your own, we are making sure that we are, through our contracting process, having these services available. So again, during that first 6-week period, we would have these services available that the state would pay for. And then after 6 weeks, maybe you could figure out, maybe you need these services from the state in the beginning, and then you will figure out how to take them on your own, so that when you have to purchase them off of the statewide contract, you don't need all of these services. But maybe you do. Maybe you need some of them. Maybe you need all of them once we get past that first 6-week period. And so the types of things that are available for a kind of additional services would be that on-site testing coordinator or manager, people who could actually do the test administration or specimen collection, and then that courier service, transporting of the tests from the schools to the labs. And I know the details here are really important. So Elizabeth, I'm just going to pause again and see if there's anything that I missed about what we expect of districts versus what we are also making available for purchase if necessary.
No, I think this is right. And to our earlier point, it depends a lot. The resources that you will need depend a lot on what kind of model you think will work best in your school, as well as, what are the ages of students within the classroom. I think that, it will probably be more expedient for school to launch this in schools that can repurpose at least the on-site testing coordinator and manager position, because then we can get started with planning right away. It takes a little bit longer to get these additional supports in place, but as Russell said, we're committed to working with you to find solutions to make sure that this is possible in all schools. So more details to come on this in terms of what kind of specifically we need from you to be able to match you with a vendor testing services provider who can meet your needs. But we are, I think that we are looking for schools and school districts to brainstorm as much as they can about, how might they internally meet the request for on-site testing coordinators and managers, and then the state can help fill the gaps. And so in order to get this off the ground as quickly as possible, like everything else, we'll think of this like a partnership and a continuing conversation between the schools and the state and the testing services providers to make sure that you have all the resources on the ground needed to make this program a success.
Great, thanks, Elizabeth. So now just quickly on the required preconditions, and then we'll go to the districts themselves. And so thinking about what would need to be in place prior to the administration of pooled testing, thankfully, it's actually in some ways, if you're already using Binex Now, for example, it's a lot less than what it takes to stand up Binex Now, just because there isn't as much personally identifiable information, or personally, the results aren't on an individual basis. And so I hope that, as you look at this, it feels doable, that we need the PPE authorization and consent for both staff and students. And we will be following up. I'll mention that more in a minute, but we will have the forms that need to be filled out so that you don't have to guess what type of authorization and consent is necessary. And probably the step that will take the most time, if you're not already involved in Binex Now, is just making sure that you have that system for reflex testing, for follow-up testing, for individual student or staff pools. And actually, we should have put students and staff here because it really is both. And then once, we'll have a system set up, what we're taking this in steps. So your first step is to, if you're interested, fill out our survey, show your initial interest, and then we'll follow up with you to ask for a confirmation that you've met the preconditions so that we can confirm that you're ready to go and to launch pooled testing through our process in your schools. And I know timing is probably a question that Lauren's getting in the chat. We're really looking for a late January, early February launch to this. So we're really hoping that we can kind of accelerate and get this going. Obviously, it'll be easier if you already have Binex Now set up. For example, if you need to invest in getting Binex Now set up, which, I mean, invest is just the time that it takes because it remains free of charge to you, then that would be something that you'd want to get going on. And we can answer any questions that you have. If you haven't started with Binex Now, we can get you started on it. So again, and I won't go through this in great detail, you can see the list here of PPE that's different for personnel who are collecting specimens versus staff who are observing the collection. So a real difference there in terms of PPE that's required, but I hope that's useful information for your planning purposes. And then, the consent and authorization that we talked about before. Again, we'll have this information for you. We'll provide ways in which you can get this, the consent and authorization without having to guess what needs to be requested of particularly parents, but also staff members. So obviously it has to include the consent to participate in pooled testing, the consent to transmit student information via technology platform, and then any consent that's necessary for the follow-up tests. And we'll make sure you have all of that in order to get started. And then, what it takes for follow-up testing for those positive pools. We just have to know that we have a way of doing the follow-up testing. This is not a full puzzle until we get that piece inserted into the mix about, how can follow-up testing be completed. Appreciate that Lauren put in the slides here where you can go to get more information about BinaX now. So I hope that if you haven't started that, please take a look at that, and we're glad to answer any questions that you might have about getting started. And now here's the really important thing, and I know our guest speakers will discuss this, but this idea of follow-up testing, many of you have a model of, for example, if you're in hybrid, where you have students in maybe 2 days a week, and they're out, they're learning remotely for 3 days a week. So, if a student is pooled on, on a Tuesday, today's Tuesday, so let's just say there was pool testing that went on today, the results are going to come back when they're not in the building. And we don't really want those students re-entering the building to get that follow-up testing. So you'll hear more from our speakers about how they thought about this, but I'm really encouraged by, for example, in Watertown, where they have one centralized location and families come for like a drive-through. They can schedule their time, they come, and students are getting swabbed. It's a PCR test right now in Watertown, and families can come to a centralized location in order to get that follow-up testing instead of having somebody who might be symptomatic, who might be carrying the virus coming back into the school building. So that's a consideration that we'd want you to be starting to make right now and starting to figure out how can you set up maybe a centralized follow-up location within your community.
Russell, I'm sorry, can I add something right there?
Amaya, please.
Yeah, hi everybody, good morning. So one thing on that exact note, I think that this is something that's going to be up to schools to figure out what the way that you are most comfortable doing this is, and that's going to be the answer. But I know some models would have students who are asymptomatic coming back into the school if they were on a remote day and they'd gotten a positive pool result for that follow-up test. I think the important thing there is that anybody who's symptomatic, so everything that DESE and DPH has said about symptomatic students not coming to school stands. So this is on top of all of that. So certainly we don't want anyone who's symptomatic coming back in. But I think from the programmatic standpoint, I know in our conversations with DPH, they have been open to asymptomatic students who are in a positive pool coming back into the school just for the purpose of the test. Just a minor note. Thank you, Russell.
Yeah, that's important. Thank you, Jeremiah. Really appreciate that. And again, so just thinking about different ways of doing this. And again, I think you'll hear from our speakers about some of their considerations for follow-up testing as well. So with that in mind, I really would love to turn it over to our very esteemed guests today. Here's the list who we have, and we'll just go in this order. So we'll start with Steve Zreich, Superintendent of Salem Public Schools, Maurice Edward Vincent, and David Murphy from Medford Public Schools. Dave is going to take the lead, and then Dee Dee Goldston from Watertown Public Schools. So to the four of you, thank you so much for being here today. We really appreciate it. And Steve, I'll turn it over to you first to talk kind of in general about the Salem experience.
Sorry about that, Russell. I needed to get unmuted here. Thanks for hosting this, and glad to see that there's so many people who are interested in testing. This is just our story. Doesn't mean it's the right story for every district. Let me just get my video here. And I'll just share a little bit about what we've been doing in Salem. Hopefully that's helpful to inform what your district or what districts are thinking about doing. And again, I appreciate the state making this available to everyone. This is a really good advancement for us for districts who are trying to bring more kids into in-person school. In Salem, we've been testing all staff and high school students weekly. And we've done that since the beginning of December. In our case, it's a collaboration with the city of Salem. Because they test all their employees, fire, police, as well as the charter school in town as part of the program, and it's been funded by the city, the mayor's office, with stimulus funds up until now. Administering the test, our test is a pool test, and it's administered weekly, like I said, and the administration of the test has been easy and straightforward. That's not been the complicated part of it. We test typically on Thursdays, and the pools are mailed out on Friday, and the results come back to us on Saturday evening or Sunday morning. And in our case, the way the testing is done does the reflex for us. It is unfortunately it's more costly than what Russell just shared. And that's a factor for us because we're not going to be able to sustain our model for the remainder of the school year. And so we're pleased to see that the state also has a more cost-effective manner of testing. But the real work and the challenge comes in two places. For right now, designing and implementing the systems to make the follow-up feasible. Once we get the information, although I'm glad to see there's a mechanism for software to manage the data, but that's been challenging for us. And then having the capacity within the district to ensure that people get contacted. There's a lot of legwork involved in that, and to make sure it happens with fidelity and that people are following up amongst the other responsibilities that they have weekly. That's been challenging. I've repurposed the senior leadership team's members' role to coordinate and lead this work. And we've used additional stimulus funds to compensate a retired nurse and our family engagement staff at every school to make contacts with people once we know how many positive pools we have coming back weekly. Just a couple of additional thoughts. I think we believe here in Salem that surveillance testing is an essential component of keeping our schools open right now. Just yesterday, we just brought back another wave of kids. So we've moved in the last week from 65% of our students having the option to attend in-person schooling to 85%. And we do have high rates here of transmission. We have high positivity rates, but we don't think it would be possible for us to be opening the doors to more kids or giving that option if we didn't have surveillance testing. With surveillance testing, we've been able to identify 35 asymptomatic or pre-symptomatic cases in our schools in the last 3 or 4 weeks. It's really been 3 weeks with the holiday. It's also helped us to identify one case of spread in a school that was within a classroom that we were able to identify because we could see that there were multiple cases in this one special education classroom. While our testing positivity rates have remained much lower than the overall community, our rates of return are about 1.7% of our tests are positive compared to 7% in the city. It's not foolproof, obviously, but it is and especially since we're not able to test everyone right now, but we think it's a critical mitigation strategy along with distancing, hand washing, improved ventilation, and quarantining to effectively keep our students and staff safe. Just a couple more points, and then I'll turn over to another district. We think that the other thing to consider is that it's important that the reflexing, as Russell talked about, is set up in a way that gets you a follow-up result on a pool as soon as possible so that students and staff are not unnecessarily kept out of school. We know in Salem that our white population is accessing and using testing at a much higher rate than our significant Latinx population. And we don't want to create situations where students of privilege can return to in-person learning, but other students cannot because they can't access the follow-up end. After and would have to be quarantined for longer periods of time. I think the model that Watertown will speak to, I think is important, but there has to be a way to get the reflex quickly and effectively and be able to reach families that may not have the privilege of even having a car to get to a place to get tested. I think there's also there's some apprehension from staff and students at first, and they're skeptical and protective of their health information. But it comes with, I think in time, we've seen more and more people buy in. I think messaging and the articulation of why this is important and why this is another way to keep people safe is critical. And then having a seamless, smooth system is that's not disruptive to teachers and staff. I think everybody's already stressed out. Their routines have already been interrupted. And if testing comes in and disrupts that even more, I think it's, will make it more challenging to get people to buy in. And it's easier to get, once, developing a smooth system that doesn't interrupt teaching and learning, I think is something that, I think all districts, is an important consideration. And then, I think the pool testing is so much less costly than regular testing. And it's even the model that the state is adopting here is even less expensive than what we're doing here in Salem. And we're hopeful that the pilot costs will come down so that we can test all our students and all our faculty here in the city of Salem. So thanks for the opportunity, and I'll turn it over to who's ever next.
Thanks, Steve, so much. Such good lessons learned. Dave, I think I'm turning it to you, but so happy that we have both you and Maurice here. Maurice, excellent. Yes. Good morning.
Good morning. Thank you. I want to say thank you to Desi, first and foremost, for inviting us to this call. And I just want to say good morning to all of my colleagues across the state. I just have to say a few brief remarks before I do pass the baton on to my Assistant Superintendent of Finance and Operations, David Murphy. In order for the testing to be successful, I do want to say that you're definitely going to need to assemble a strong team. Another piece that you should really be aware of is there has to be frequent communication to families, especially those consent forms, and getting them translated. Convincing families that it's not an invasive test, that was important, so much so that I did a brief commercial to demonstrate what happens during an actual test. So that could just be one way to promote active participation within your respective districts. Active emails are very necessary to continue to communicate with the team. Logistics and timing, and working closely with your principals. None of this would have been able to have been done if I did not have an outstanding supervisor of our nursing department and health services, Tony Ray. I wish you would wave to us, Nurse Ray, in the background so they can see you, working hard always. Testing, I just want you to know, is a big undertaking, but it's doable and worthwhile. It gives peace of mind to both staff and students. And I think, again, it's worth it. And I'm very, very happy that Desi is supporting and offering this initiative to the entire state. I do want to pass the baton right now on to my Assistant Superintendent, David Murphy, who will really talk about the logistics specifically in Medford Public Schools. Thank you.
Thank you, Dr. Edward Vincent. So I'll just briefly recap the story of COVID testing in the Medford Public Schools. We began our testing program in September, testing staff on a weekly basis. We were able to enter into an agreement with our teachers union to have mandatory weekly testing, so that they've been doing that on a regular basis since the last week of September. And that put us in a position to sort of ramp up and eventually get to a place where we had the capacity and had developed the operational muscle necessary to test students on a weekly basis as well. The other very important factor for our district was a partnership that we've entered into from the very beginning of the testing program with Tufts University, working closely with the Chief Technology Officer at Tufts and his team, developed the platforms that we're utilizing. And that, again, put us in a position where we were able to expand our capacity. And similar to Salem, our mayor and the city of Medford, this has been a high priority in order to keep students in school and bring students back to school as quickly as possible. So by the end of November, our staff was sort of in the habit of every week coming to the testing location. We're on Monday, Tuesday, Thursday, Friday hybrid plan, with Wednesdays being fully remote. So we had the testing station set up for staff every Wednesday. When we transitioned to student testing at the end of November, we changed that to Tuesday, Friday, in anticipation of eventually transitioning to pooled testing. We've been doing individual testing up until this point, but having the remote day and then the weekend immediately subsequent to the testing day put us in a position to avoid some of the logistical challenges that were being alluded to earlier in making sure that people get the reflex testing within the appropriate time frame. Some of the other key variables that we've had, the superintendent spoke about Ms. Ray's involvement. Ms. Ray, in her capacity as the head of health services for the district, entered into partnerships with higher ed institutions to bring on board a large cohort, relatively large cohort of student nurses who are in a position to help us make sure that we're able to keep our testing working on a very efficient basis. They're also volunteers, so they allow us to do it on a very sustainable basis, which has been helpful and something that we're grateful for. I think if there was sort of one headline that I think other districts would want to know about the work that we've done. And it was frankly something that we were concerned about going into the student testing. There was a lot of concern on our part that this would become disruptive to the instructional day. And given that our students are in person so much less than we would prefer that they be, even under our hybrid plan, and as of Thursday, having all K-12 students in person under the hybrid plan, we were concerned that the one of the 2 days students were here in person would just become all about the testing and the logistics of that and going to a testing station. We went back and forth about whether we should do testing on a cart with personnel coming to each class, or whether we should have a single testing station within the school. We ultimately decided on the testing station. And by the second week of student testing, we were having full classes of elementary students come in and out of the testing station in under 5 minutes. So that's certainly a testament to the staff and the people that we've redeployed and changed their responsibilities to have working these stations. You'll see as you set these up, if you choose to do the testing station, that there are sort of defined roles. There's the person in charge of the line, there's the person in charge of checking students in, and then there's someone at least for us, at the secondary level, observing the self-swabbing, and then at the elementary level, actually conducting the swabbing. That's another sort of strategic decision you'll have to make as you begin to set that up. But we found that both at the elementary and secondary level, having that distinction, it's worked very efficiently. We've minimized the disruption to the instructional day, which we're happy about. And my last sort of cautionary note that I would put on is that if there's one piece that could really put a district in a position to be ready to do this and do it well, it's to have as sound a data practices as possible. The sounder your data is in terms of having student information that is accurate, that is organized well, and that you're then able to utilize for purposes of doing this testing, you'll save a lot of time in the actual execution of the work, because Maurice talked a little bit about the consent forms and the importance of getting that in. That's one piece of making sure that you have the data that you need to be able to do it and do it well. So that's our story. We're happy to answer any questions now or later. If any districts are out there and hoping to bring this to your school systems to try to keep kids in school or get them back, we're more than happy to share our experiences.
Thank you both so much. Maurice, I wonder before we go, I just checked in the chat and I'm seeing that coming to me personally, and again, please send me your questions to the host, which is Lauren Wu, but I was noticing that I was getting questions about the grade levels that the districts are testing. Could you just speak to what grade levels, Maurice, the district is testing?
So we're currently testing K through 12, pre-K through 12. Everyone, our MEET programming, which is our early childhood program, as of Thursday, we will have the remaining rest of grade 11, 10, and 9 joining us. So everyone is tested twice a week, Tuesdays and Fridays. And, you know, are most vulnerable in 4 days a week. But again, that was intentional because Wednesdays is our in-person day. So because we do get our results within 24 hours, we test Tuesday, Wednesday, contact tracing all day to notify families. And then the same thing Friday, test on Fridays for that second cohort, contact tracing all day, Saturday, Sunday. And so that worked for us. It's a lot of work. I don't want anyone to underestimate that. But again, with the new structures that you guys are putting in place, I think it's wonderful, and I do feel it's doable.
Great. Thank you both so much. Really appreciate that. Dee Dee, bring the house down with the Watertown story as our last guest speaker today. Really appreciate the work that you're doing there, in addition to our other speakers we've heard from. So would love to hear the Watertown story.
Great, thank you. So as the others have said, I'm greatly appreciative of DESE's moving forward with this launch for pooled testing. And one thing I think we have to acknowledge is that actually this is a great time to start, because I think we'll be doing this all the way through the end of the year. So let's get going and make it happen. So similar to my colleagues, we began our program in early fall. We started with staff. We did staff testing beginning in October, individual PCR testing. Really helped us to get our systems in place by starting smaller with our staff pool testing. We did move to pool testing for students in November. And I'm just going to go over a little bit about how we do it. So Watertown is similar in the fact that we're hybrid. We're actually in every other day, which I think has been actually pretty advantageous for testing. But we are testing K through 12. We're not doing pre-K, but we are K through 12. It's a little different at each of the levels. So at elementary, we cohort our kids by classroom in terms of the pools. So we never commingle. I'm going to give you a little tip. Please do not commingle your pools as much as possible, because then you're taking out potentially 2 groups of people. So we stick to 1 per classroom. It is testing on a cart. So our school nurses have a cart. They walk around, they knock on the door, the kids come out. Takes, as was just said, 5 minutes max. So we've gotten that pretty down pat for our elementaries. Middle school, the same thing. We test by homerooms, and we do it during their mask breaks. So it is more of a station that works, I think, very well for the middle school students. And then our high school students, since they are not necessarily cohorted in a traditional like middle school elementary, they just come in during lunch and they do their testing at a station. So that's working very, very well. I did bring the sample just in case you wanted to see what the little swab and the vial look like. So right now, just in terms of data, we are at 78% of our students have voluntarily signed up. So, we were targeting 80%. I'd love to get to 100, but right now every week it just keeps growing and growing. And I have a feeling we're going to get to that closer to 100%, especially as the virus continues in the prevalence that it is. Same thing, 24 to 36 hour turnaround. We've submitted to date 384 pools for testing, and we've had 9 positive pools come back. So, pretty good again in terms of percentages. We're well under 1%. It's actually like 0.33%. And again, I think it was said before, that simply means we're testing enough kids to really look at what's happening within our schools in terms of asymptomatic carriers. So let me just talk a little bit about reflex testing. So as we said, it's pretty labor intensive. We call individually all of the people who were in a positive pool. They are told to quarantine and isolate until they come back for their tests. We do centralized at the middle school, and yes, it is a drive up. So the families basically drive up and wait in their cars, and our staff members will go out and administer the individual PCR test at that point in time. And then, our turnaround time is very quick with that. So we're able to know by that evening who is the positive person in the pool, and then move forward with what it is that we might need to do. I would say that similar to what we heard from our colleagues, we stipended 2 of our school nurses. They run the program fully. We were fortunate to have pretty much a dedicated float nurse that we had, that we thought we would normally need as a float nurse, who is really taking on the charge. But all of our school nurses are the ones that swab the students, especially at the elementary level. So we've got a good team effort on that one. And then I just wanted to talk about the benefits. Oh, and I would like to mention that one of the things that was very powerful for Watertown is being part of the Safer Teachers, Safer Schools collaborative in the beginning, just to pool, ideas and resources together. And one thing I got from them was a survey, and we are in the process of surveying our staff and our families. But right now, just as a data point, I asked the question, if you had all the PPE that we have, but without testing, how comfortable would you be? And it was only 14% said they'd be comfortable, and 78% said they wouldn't be. But with the testing, and this is, enough, it came out exactly 78% were comfortable with the testing and 14 were not comfortable. So I think you can draw a little conclusion about the reassurance that this is giving our staff in terms of really feeling safe in our school. And sum total, we've tested we've had 6,000 tests that have been completed. And our percent positivity rate with staff and students is about 0.21%. So pretty exciting. So just a couple of tips. Again, I mentioned before, our school nurses are amazing, and, you have to get that strong team. We've heard that from our colleagues as well. And one other thing, and yes, it is hard, and it is important to get, some of your logistics down pat, but don't get too wrapped up in perfection, because we did learn that as we implemented, we learned a lot along the way. And, the first couple of weeks might have been a little more chaotic than one might have wanted. But if we didn't get going, then I think we wouldn't be where we're at today. But right now, it's a pretty well-oiled machine. And, like I said, just forward in whatever way you can, because once you get going, you'll figure out how to make it work really well. And I just put it as an offer. Feel free if anybody wants to send anyone to observe our testing process. We have people coming and going all the time. So feel free to do so. Just send me an email and I can set that up for you. So once again, all I can say is it's been exceedingly beneficial for Watertown. I echo the fact that I think this is one of the reasons that we're able to stay in school, even given what we're seeing in terms of the virus. And I'm very optimistic that that's going to continue moving forward. And, you know, it's well worth the effort. And so, like I said, let's do it.
Fantastic, Dee Dee. Thank you so much. And thank you to all of our guest presenters. And I apologize if I botched up any of the handoff. We did a little bit of prep ahead of time, and I know that there were probably some other things that I was meant to cue or prep or be ready with. And so you've all been very patient with me as we pull this off today. But I sincerely appreciate the lessons learned that you're able to share, and kind of the attitude of can do, that this is possible, that it's a challenge, but it's a challenge for taking on. And so I hope that everyone else can kind of share in the lessons that you've learned as we continue to move ahead with this cutting edge but not bleeding edge initiative. So just quickly, the next steps, we'd mentioned that the initial survey is due back to us by January 15th to indicate your initial interest. After that, we ask that you begin, based on what you're hearing, thinking about what are those resources that you have, and what more would you need in the way of purchasing in the long run, sort of thinking about this in the from now till the end of the year. How would you stand this up? How would you get it going based on what you know that you need to provide versus the state providing, or that you could purchase? We will ultimately send final approval to those who confirm their confirmation, but we will provide support for those prerequisites to get you ready for that confirmation. So I know that Elizabeth, Jeremiah, Lauren, and I, and others are already talking about kind of what are those next webinars that we think we need to run for you? What do we need to help you with to get you kind of up and running and ready? So if you've expressed your initial interest, or if you do so by January 15th, we'll continue to follow up with you on supporting prerequisites so that you can confirm your participation and move forward. I really appreciate that Lauren has set up an email address, the K-12 COVID testing email address, that you can send your questions to after today. But speaking of questions, and really appreciate that we have so many great experts here from the districts, from Health and Human Services, from DPH. Let's see what questions that you might have for about 10 minutes or so here. So Lauren, I'll turn it over to you, and you can pitch questions to any of us.
Sure thing. Great, thanks. So we got a lot of questions in the chat, and just to remind everyone, we are going to be downloading this chat and releasing a separate frequently asked questions document. So if we didn't hit your question either in this short segment right now or directly by response, then we will be creating that FAQ and sending it out so that you have questions answered. So lots of questions about the pool size and how to create pools. And so to kick it off, folks are wondering, could pool samples be collected across different schools and levels, or does it have to be consistent each time you collect the pools?
One of the ideas that we've really been thinking about is the stability of the pool. And like we heard about from our guest speakers, thinking about sort of who will be that stable pool that you are collecting from, so that you don't have to, you get a positive result back, that you're not guessing who was in that pool, or that you're not putting out and making more students or staff stay out of the school than is necessary. So I think one of the things that we'd want you to be thinking about if you're interested in joining is how will you set up that stability of pool. And I don't know if any of our other guest speakers from districts or public health want to.
Can I jump in here on this one, Russell? Hi, everyone. I think the other thing is we will be coming out with some guidance around this in terms of what pool sizes would work for your school or school district to start. And there's obviously a number of factors that go into that, but one of them is just what is the community incidence and positivity rate, where, if you're in a community or county that has relatively low transmission right now, it might be more appropriate for you to start with pool sizes of 10, or we even will have a pooled testing provider that can go up to 25, where maybe an entire classroom could go into one sample. That said, we will be encouraging folks to start small and work their way up depending on what they see in the data. So it might make sense to say initially start with 2 pools of 10, and then if you see them consistently coming back negative week after week, you could go to 20 and have that whole classroom in one tube. But for a school district that might be in a very high, community rate of transmission right now, we would probably recommend that you might start even with pools of 5 and work your way up to 10 to make sure that you don't have, pools coming back positive and have to do follow-up testing right away that first week. So we'll come out with some guidance, at least around, some factors to think through when you think about how big your pool should be within your school. But there are a number of options, and our vendors basically will support anything from pool sizes of 5 up to 25. And so there's kind of different solutions for different needs.
Great, thanks, Elizabeth. So lots of questions about Binax Now and the use of the tests for reflex testing. So there are some questions about, for districts that are already participating in pool testing outside of this initiative that we're talking about, can they use the Binax Now test to confirm positive pools? Right now, our directive is for symptomatic adults and students only, and so they're wondering if they can use them for reflex testing ahead of this initiative.
Dr. Brown, do you want to take that? Or Elizabeth, sorry.
Yeah, sure. I think my feeling on this is that this is what the plan is anyway. So I don't see any reason why districts that are already doing pool testing couldn't implement this process.
Totally agree. And if additional Binax Now tests are just needed in terms of supply, because you might need more for that use case, you should submit the request via the normal process, and DPH will deliver them.
Great. That was getting to the next question. For districts that are not already participating in the Binax Now initiative, how do they opt in?
Lauren, do you want to take that?
Sure. So we put some information in the slide deck on how the preconditions that are required. There is a memo that's on our website, and so you can begin those preconditions. And if you have any questions, feel free to email that K-12 COVID-19 inbox, and we will send you all of the instructions for you to get started right away. And so then there is a question about, are they required to participate in Binax Now testing? Could they set up their own separate PCR reflex testing and not participate in Binax Now and still participate in the pool testing initiative?
Elizabeth, do you want to take that?
Yeah, I would say we will have guidance very shortly on that. We are still finalizing the set of options, not just from the state's perspective, but from the testing services providers' perspective. And, I do think one of the biggest considerations for schools here as they're thinking about this is just the increased time of results that are necessary, right? You'll have to figure out what to do with the positive pool members for the 24 hours before the PCR test result comes back, as well as just the increased cost of carrying that forward after the 6 weeks. But we will come out with some specific guidance around, outside of Binax Now, what the other options are, how much do they cost, and, how they would actually work to be implemented, I'd say within the next week. So watch for that.
Great. So a question about who can perform the actual tests. And so in our slides, we listed trained school staff. And so folks are wondering, what does that mean? Does it have to be a healthcare professional, for example, a nurse, or can it be observed or obtained by a teacher or other educator and then submitted for transfer to the lab?
Yeah, so
Okay.
there's a wide range of individuals that can be trained to do the swabbing, and I believe that there are resources available that I don't know if Elizabeth can put in the chat or if we will send out afterwards, that sort of outline what the training is, but no, it does not have to be, a nurse practitioner or a physician. And the training process is relatively straightforward, is my understanding. Yeah, sorry, that's it.
And one thing to add, Dr. Brown, I think that's absolutely right. And then, additionally, we'll come out with very specific guidance around when I'd say observed self-swab. So like a teacher observing students doing the swabbing themselves is appropriate, and how you can utilize that.
And I also maybe just want to mention that, sorry, Lauren, go ahead.
Go ahead, Russell. Nope.
There could be some differences based on the vendors that we work with in terms of how the swabbing will actually occur as well. So that adds to the mix as well, but more to come, like Elizabeth said.
I know we're right at time, but we have two really important questions that I want to make sure that we answer. Russell, can you just review the contract and who pays for what and when?
Sure. So we will kick off a 6-week initial launch, an early launch of this initiative that the state will pay for, and we included in that slide the services that we would be paying for, which is fairly comprehensive in terms of the lab processing, the technology, the customer support, the technical support, the training to get you started. So really a lot of what you need externally to be able to start this model. There would be additional services that we will also pay for. So those, if you don't have the ability to administer or oversee the test administration for that 6-week period, we would also fund those costs. At the end of the 6-week period, then we will have a contract available for you to purchase off of to make that procurement process easier for you. And to make any of the kind of, any of the negotiation process we will have worked out already with vendors who are ready to go. We really appreciate their eagerness to get to support our students in Massachusetts, our staff in Massachusetts. So kind of a 2-step process. It's all optional, so you can join the early launch if you want, or you could join once we have the contract available for you to purchase from.
Great, thanks. And the last question, Russell, we got is, what if some students or teachers refuse to participate? And so districts are asking if this is a mandatory for school attendance, or how do they deal with students who opt out of the pool testing? Yeah,
and maybe I'll quickly just say that it is optional for our students as well. And what I heard in our prep from our colleagues from the 3 districts that you heard from is that we, that as this has moved along, more families that were maybe initially reticent see that it's worthwhile, and they're joining in. Really loved what Maurice talked about in terms of the video that she made to try to convince and show families firsthand how minimally invasive this is. And we heard Dee Dee talk about 78% of Watertown families have participated. So it's not they don't have to. And the last thing that we would want is for students to be kept out of school if they won't participate. That just would not be acceptable. But hopefully through the power of just, honest information going to teachers and staff and students, we could get the highest level of participation possible. I don't know if any of our superintendents want to have the last word on that because you're doing this firsthand much more than I am.
Yes, thank you. We do not yet have 100%. We're in the 80s right now, low 80s, and we're working to get to the 100%. Some families are just against maybe personal reasons. With staff, we have worked with our teachers union, and they have committed to 100% participation. So we did work on collectively bargaining that. But again, you do need to get to a high enough percentage to make sure that it's worthwhile. So I just encourage you to try your best and try to get up, over 80 or 90%. The higher, the better. That's my recommendation.
Excellent.
Yeah, Russell, I'll just say 2 things about that. One thing we did that worked with a pilot we were doing with middle schoolers is we made it more of a science, that we called them, scientists, and we made it a sort of an attractive way, that they were the leads on, and the kids really responded to. I think they were initially scared, but as you were describing with your son, once they did it the first time, and so that's one thing. I will also say that we call them citizen scientists. That's the term, what we call them. But we have actually mandated for athletes, and the advice of our attorneys that we felt like for athletes in order to participate in winter sports, the students do need to get tested. So I don't know, I'm not sure if other districts are doing that, but we're not allowing our athletes to play sports unless they consent to weekly testing.
Great.
Yeah. And I'll just say that we're about ready to mandate for athletes, given the prevalence that we're finding in our teams. But I think that once you get to 75 or 80%, what we're doing right now is that direct outreach, meaning we've got it's almost like a Jerry Lewis telethon, calling all the families and trying to make sure that they understand, why this is so important. And I think that's why we're seeing increasing numbers as well. But you're right, there will be a few who aren't going to end up doing this, and unless it is mandated, then, you know, at least you're to a place where you feel really comfortable.
Great, great. Well, I know that we're at time. I know there are more questions, but I just wonder if we can't get some applause, if you want to put some reactions using the Zoom reaction feature to our district leaders who joined us today and who have really shown us the way that this is possible. Just a huge round of applause for the work that you've done. And thank you for all of you for your interest, for being here today. We look forward to following up with you with more information and writing to come, and additionally, follow-up webinars like Elizabeth mentioned to get you the information that you need. So thank you to all of you for being here today. You have a great rest of the day. Thanks again. Take good care.